Hello and good afternoon, everyone. Hope you're having a very functional and happy day. And yeah, maybe enjoying the sun a little bit, but in the shade, it's a little warm out there. Okay, so we have a class, was requested. It's follow-up class to our class on Monday. So it has to do with COVID and the summer surge. And what to do since, this virus is still around. What to do in order to keep yourself and your family safe. And there's always little tips and things like that you can do, but here's something where it says, and this is written by somebody from Kaiser, but what to do if a family member tests positive and how to COVID-proof your home. And so it says the best strategy for avoiding the COVID virus is to make indoor air as much like the outdoors as possible, is what experts say. So, and again, this from somebody from Kaiser Health News, not Health. So for 2 years, you beat the odds, kept your distance, got your shots. Now, despite those efforts, you, your child, or someone else in your home has come down with COVID-19. Now, the last thing you want is for the virus to spread to everyone in the family or household. But how do you prevent it from circulating when you live in close quarters? Which is a tough thing. And the surge, because of the BA2 variant, is much different than Omicron and anything. It's less. I don't know. It's still pretty bad. It's kind of flu-like, but it also is a lot more contagious. So, when you're living in close quarters and say somebody does have COVID in your home, what do you do in that situation? So the CDC, or Centers for Disease Control and Prevention, recommends isolating COVID patients for at least 5 days. Preferably in a separate room with access to their own bathroom, as well as diligent mask wearing for both patient and caregiver. But for many families, those aren't easy options. Not everyone has an extra bedroom to spare, let alone a free bathroom. And young children should not be left alone, and the youngest can't tolerate masks. Well, they can, but I can see some young kids will just be like, nah, I don't want this on, and I'm going to take it off every chance I get. So, for parents of a young child, it's pretty difficult not to be exposed, said Dr. Preeti Malani, Chief Healthcare Officer at the University of Michigan. And this could be for anybody who, it doesn't have to just be a child. You have to work back from the perfect to the possible and manage the risk as best you can. But take to heart, scientists say there is still a lot of people can do to protect their families, chief among them improving ventilation and filtration of air. So ventilation matters a lot, said Dr. Amy Barzak, an assistant professor of medicine at Harvard Medical School. And they say if you're taking care of someone at home, it's really important to maximize all the interventions that work. To understand why good ventilation can make a difference, it helps to understand how the novel coronavirus spreads. Scientists have learned a lot in 2 years, but it's infectious mechanisms, about its infectious mechanisms. So viral particles, which is, when you sneeze or anything like that, float through the air like invisible secondhand smoke, diffusing as they travel, which, just means the further they travel, they slowly diffuse into not being there, much like smoke. Outside the home, viruses are quickly dispersed by the wind. Inside, germs can build up, like clouds of thick cigarette smoke, increasing the risk of inhaling the virus. So open windows. The best strategy for avoiding the virus is to make your indoor environment as much like the outdoors as possible. Start by opening as many windows as the weather allows, said Joseph Fox, a heating, ventilation, and air conditioning engineer for a large school district in Ontario, Canada. Good job, Canadians. If possible, open windows on opposite sides of the home to create a cross breeze, which can help sweep viruses and bring fresh air inside. So if you do have like a big hallway or something like that, that's kind of what we have. But if I open up this window down here, and the window at the end of the hall down there, it creates a great cross breeze. And we have been getting wind lately, so it's a very, it's manageable to do. So for extra protection, place a box fan in the patient's window facing outward to draw germy air outside. Seal any openings around the sides of the fan, said Jim Rosenthal, CEO of Texair Filters, a company that manufactures air filtration products in Fort Worth, Texas. So it's simple and it's cheap, is what that Rosenthal fellow said. To prevent infected air from seeping out of the sick room, Fox suggests wedging towels under the gap of the bedroom door. People should also cover return air grills with plastic. These grills cover the vents that suck out air of the room and recycle it through the heating or cooling system. But be careful with that. Sounds like it could be a little dangerous too. Next, what you want to do is turn on exhaust fans and increase humidity. Doesn't sound like fun during the summertime to increase the humidity, but so Fox also suggests turning on bathroom or kitchen exhaust fans, which can shuttle germy air outside. Although running exhaust fans while taking the shower is relatively safe, Fox said, it's important to open windows when running the fan for more than 10 minutes. That's to avoid depressurizing the house. So you want to keep the level of pressure consistent in the house. And a circumstance that could result in carbon monoxide being pulled into the home from the furnace or water heater, which you don't want. But most of us, I don't know if you have to have it, but most places I've lived, there's a carbon monoxide detector. I've got one right over here, plugged in and ready to go. So coronavirus thrive in dry air, and increasing the amount of moisture in the air can help deactivate them. So water is good, and that's the humidity part of it, said Lindsay Marr, a professor of civil and environmental engineering at Virginia Tech. Marr suggests increasing humidity levels to somewhere between 40% and 60%. So you don't want a dehumidifier, you want a humidifier. So using portable air cleaners can provide additional protection. Research shows that high-efficiency particulate air filters, or HEPA filters, which have been installed all throughout program, as those HEPA filters are what they use on planes, can remove coronaviruses from the air. If people have only one HEPA filter, it's best to place it in the sick room to trap any virus the patient exhales or breathes out. You want to put a filter as close to the source of the virus as possible, Fox said. If affordable for families, additional air cleaners can be used in other rooms. Oh, neat. Now it says how to build your own portable air cleaner. Well, let's see how expensive it sounds and how easy it is to put together. Makes me think of the movie Apollo 13. Like, okay, so I need a square peg to fit in a round hole, or vice versa. So store-bought air purifiers can be expensive, with some models costing hundreds of dollars. Yet for about $100, people can build their own portable air cleaners using a box fan, 4 high-efficiency air filters, and duct tape. These do-it-yourself devices have been dubbed Corsi Rosenthal boxes. I'm guessing it's that Rosenthal guy that was mentioned earlier, after their co-inventors Rosenthal and Richard Corsi. Dean of College of Engineering at the University of California, Davis. Oh, California, yes. But seriously. The low-cost boxes have been shown to work just as well as commercial air purifiers. So Rosenthal said that the pandemic motivated him to design the air purifiers. We're not helpless, Rosenthal said. We need to provide tools that people can use right now and make things better. Although nursing a loved one through COVID puts the caregiver at risk, the danger is much smaller today than in the first year of the pandemic, obviously because of the vaccination shots and the boosters. An estimated 95% of the population has some immunity to the coronavirus, due to vaccines, prior infections, or both, said Dr. Paul Offit, Director of Vaccine Education Center at Children's Hospital of Philadelphia. Nonetheless, it goes on to say, a recent study found that half of the people living in an infected patient's household also contracted the virus. 50%, that's not good odds. Given that older people and those who are immunocompromised are at higher risk for COVID, they might consider staying with a friend or neighbor to get, if possible, until the sick family member has recovered. So, if that's a possibility, a professor of, said Priya Dugal, a professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health. So patients can be considered COVID-free after a negative PCR test, Barczak said, because patients with even tiny amounts of residual virus can continue to test positive on PCR tests for weeks, long after symptoms disappear. Patients can also use rapid antigen tests to assess their progress. If antigen tests are negative 2 days in a row, a person considered less likely to be contagious. So, there you go. When it comes to this, if you happen, knock on wood, well, if you happen to get the virus or somebody in your house does, try to make the inside kind of like outside. Well ventilated air is what you want. So open up windows, that helps combat. And then of course if you can increase the humidity in your home, that's going to help disperse and bother the virus so that it can't get around as easily. So again, thank you for this suggestion, and this is another safe tip. Good for us all to have, and again, there are a lot of people getting the virus right now. The summer surge is going on, and people want to be outside at picnics, weddings, barbecues, all sorts. So please stay safe. Let me know if you have any questions or suggestions for other classes on things that you would like to know more about. It doesn't have to be COVID, obviously. And if you're tired of hearing about COVID, please suggest other classes that you do want to hear about so that, we can mix it up. All right, but it is important to stay safe. Let's stay safe, everybody. All right, I'll see you all later.